CG, and we also have Dr. Tariq Kapasi and Helen Thompson. Helen Thompson's from Leicester Partnership.
We can't hear you.
Involved in the rollout for the vaccination program, and Dr. Tariq Kapasi is a local GP with Willers Healthcare. So, first of all, good evening to everybody.
Good evening, Zafar.
Good evening.
Good evening.
I just wanted to start off with the first question, really. If Tariq can answer this, really, it's a question in Tariq's direction. What is COVID and why is it so dangerous?
So COVID is a virus. It has the potential to cause lots of complications. The data shows that within British ethnic populations, there is a higher risk of complications, which is why the listeners to this show really must take every precaution that they can to reduce their risk of complications. So the complications can be COVID pneumonia. It could be admission into COVID in hospital requiring oxygen support, and ultimately, unfortunately, in many cases, death. And I've seen so many of my patients across Leicester City, not just in older age groups, in younger age groups too, who have died from this ghastly disease.
Excellent, thank you. And one of the other questions that is always being asked is how come the COVID vaccinations were developed so quickly, and why, how effective are they as well?
So I think we've done really well with the COVID vaccination delivery, to the point where millions and millions of people are now vaccinated against the coronavirus. And what this means is that we have real world data about how effective the vaccine is. And what we are demonstrating is a significant reduction in coronavirus cases and a significant reduction in hospitalization and death. And that partly is due to the coronavirus vaccination. And I'm hoping, as our millions of patients have had the coronavirus vaccine, they've seen firsthand that this is a very, very safe vaccine, where the benefits of receiving the vaccine outweigh the risks. In terms of the timeline it took to develop the vaccine, yes, it was shorter, but that shorter timeline in developing the vaccine didn't sort of compromise any of the safety aspects of development of this vaccination. So we are actually in Leicester, in the United Kingdom, in a very privileged position worldwide to be in a position where we can take the coronavirus vaccine and protect ourselves and our family members from the complications of COVID. Like you, Zafar, I'm really keen on getting back to some degree of normality, and I think the coronavirus vaccine is our passport out of that.
So coronavirus vaccine is the passport out of this lockdown, really. I just want to come to Yasmin and maybe Helen as well, but first to Yasmin. How is the vaccine rollout going in Leicester, and how effective is it being received by all communities?
So the rollout of the vaccine has been going pretty well, actually, across Leicester and Rutland. So we've now administered over 650,000 doses across Leicestershire and Leicester and Rutland, which is really positive. So it's going really well in terms of that. For Leicester City, we've got just under half of the population vaccinated. So we're sitting around about 47% of our total population in Leicester vaccinated, which again is good. We've still got a way to go, and this is really important, and this is why being on here and talking about it today is really important as well, because the more information we can share with people, more likely people are to take the vaccine when they're able to do that, and when they're invited to take the vaccine as well. We're also on our focus at this moment in time has been around the second dose. So, we've done really well with the first dose, but we're now out giving the second dose of the vaccine. And again, the message is, if you've had your first dose and you're now invited for your second dose, please go, because the vaccine is effective once you've had, it's effective when you've had the first dose. It's even better once you've had the second dose. It gives you much better protection for you and your families.
Excellent, thank you. And Helen, what have you been doing over at the People Centre elsewhere in the city and county?
So we're part of the offer across Leicestershire and Rutland to vaccinate people. We're called a mass vaccination centre, and we can do up to 1,560 vaccines per day. We opened on the 25th of January, and since that time we've vaccinated around 64,000 people just through our centre. Tariq, however, in terms of the GPs, have played a huge part in vaccinating their populations who are on their GP registers. And so, anybody that's listening at the moment, your GP is able to vaccinate you at their local, they're calling the local vaccination site, LVSs, or there are a number of hospital hubs. So Loughborough is also vaccinating some of the general population, Fielding Palmer as well, and some of the acute trusts, they're vaccinating their patients. And then we are the sort of the choice. If you want to come down to the People's Centre, then we offer appointments for first and second doses, and that is in line with what they call the Joint Committee on Vaccinations and Immunisations, who have actually looked at all the evidence about who's the most vulnerable, and we're working our way at the moment through different people in the population based on how vulnerable they are to becoming acutely unwell with COVID. So obviously we started with the over 80s and health and social care staff, and we're now opening up vaccinations for people who are 45 years and over. So at the People's Centre, and it's just such a great place to work, and obviously it's at the heart of the Belgrave, so it's really very accessible. And we've got loads of local volunteers who are helping us out. It's going very well. And we're concentrating, as Yasmin said at the moment, on the second doses. And it's so important that people do come in for the second dose, that one dose, as Yasmin says, okay, but 2 doses, it gives you lots more protection.
So the second dose is the one that really gives you the effective coverage from
It really does, yeah, really does.
If any listeners have any questions, they can call us on 0774 885555. That's the WhatsApp number. You can contact us via WhatsApp if you've got any questions, or you can give us a call on 0116 48222086. That's Radio Ramadan on 87.9 FM. You're listening to the NHS Show. I'm Zafar Haq, and we're talking about COVID-19 and making sure that everybody's got all the information. Lots of questions that have come in to me earlier on during the day is, people who are the younger age groups, who are in the 20s and the 30s, who think that even if they get COVID, it's not going to affect them that much. What's the take on that, Tariq? And then I'll go to Yasmin as well.
Thanks, Zafar. Most people who are in the younger age groups do not develop severe complications of the coronavirus. But what I'm seeing in my practice population is up to 10% of patients who are in the younger age groups are developing long COVID. So whilst coronavirus may not kill you, it might give you complications in different ways. And long COVID is a debilitating condition, which we are currently trying to understand. In addition to that, if you develop coronavirus as a young person, you're more likely then to go and give it to somebody who is older. So if you're living in a multi-generational household and you as a young person develop COVID, you're more likely to give it on to somebody who's more vulnerable. The vaccine does protect you. And I'm hoping vulnerable members of multi-generational households at least have had the coronavirus vaccine. But it still means that young people have a responsibility to protect the vulnerable around them. The other thing I'd say is that I've also lost, unfortunately, young patients to this disease. I think the youngest person that had died that I know of in the group of patients that I was looking after was a 33-year-old South Asian lady with 3 children who had no sort of risk factors for developing the complications of coronavirus, but unfortunately did go and die. And if you actually speak to our hospital colleagues, even during the second peak, often the ITU beds were filled up with younger people with COVID. So it's not a benign disease. We are on the way out, and vaccination is the most effective way of getting through this.
Thank you, Tarek. And the other sort of question that comes out, there's lots of myths just generally about the COVID vaccine. It can change your DNA, it can stop your fertility or reduce your fertility. It changes. It can be tracked. You can be tracked by it. What are the truths about these myths that are going around?
So they're not true, Zafar. Categorically, there is no scientific evidence to back any of these myths up. Unfortunately, lots of people within our community use WhatsApp, and often you have lots of myths which are propagated through different forums. And the COVID vaccine doesn't affect your fertility. It doesn't change your DNA. There's no chip in it. And I suspect we have saved lots of people who have even taken the coronavirus vaccine and listening to this show, who may have actually gone on to develop complications, who are now actually with us, alive and well, listening to this show as a result of them taking the vaccine. And more importantly, or rather equally, they are able to fulfill whatever they need to from their faith perspective by enjoying a healthy Ramadan.
And Yasmin, how do you find, the issue about younger people and the take-up from younger people?
Well, at the moment, obviously, the eligibility group is 45 and over, so we're just starting to move into that under 50 group. And up until recently, the over 50 group, the take-up has been relatively positive, particularly from a lot of our communities. Although some of our communities, there has been still quite a lot of hesitancy, particularly from some of our Bangladeshi community, Pakistani community, and our Somali communities as well. Some of the things we've been doing around that at the moment to understand those reasons for hesitancy and to tackle those head on and to work with those communities as well. So recently what we did in the St. Matthew's area with the Somali communities, worked with the community to tackle and answer the questions that people had from those communities around COVID vaccine, COVID itself, and we dealt with those issues. We also ran a pop-up clinic, and it was actually really successful. So we had about over 500 people that attended that pop-up clinic from the St. Matthew's area. And what we were able to really do there is take the vaccination program out into local areas, local communities, so that people could build trust with the NHS, with the team and the people that are administering the vaccine, but also be able to have the opportunity to ask questions head on, really on a one-to-one with their particular concerns and worries that they've had. And there are lots of different concerns people have got. People are worried about, especially recently, around the AstraZeneca and the side effects. So we touch on that, and I'm sure Dr. Kapasi will talk about that as well. So there's lots of concerns, and what we've been doing is working with those communities, working with local people to look at how we can deliver the vaccination program out into the community as well, and how we encourage them to trust them to feel that they can access the vaccination as well.
Thank you. You mentioned there the AstraZeneca vaccine, and there's lots of talk over it, both locally and nationally and internationally. What is your take on the AstraZeneca? Where can people get the information from to make a real informed choice?
Okay, so I'll let Dr. Kapasi come in on this because he'll be able to give a view on that.
Dr. Kapasi, you could give us your thoughts.
Yeah, thanks, Zafar. I think we just need to be really clear with what we're saying about the AstraZeneca vaccine. So I just want to take you away from the AstraZeneca vaccine and just follow me in a completely different train of thought. So we often think some simple medicines in our cabinets are benign, right? So you get a headache, you decide to take some paracetamol, right? Most of the time, paracetamol is completely safe. However, there can be situations where paracetamol can result in liver failure, right? So that's going to occur once in millions and millions and millions of people. It's very rare. So any medicine or any treatment has the potential for risks. Now, what the data shows is that the benefits of the AstraZeneca vaccine far, far, far outweigh the risks of it. And whenever a new drug is actually put into market, people are always concerned about any potential risks. Now, what we've found is that with the AstraZeneca vaccine, there is an association with blood clotting, but that association is very loose. And so I think it's in the order of 4 to 5 per million doses of vaccination. So if you put that into context, you're going to have far more coronavirus cases per million than complications from the vaccination, number one. And number two, I think there was a study by Oxford University published this week, in fact, which demonstrated that the risk of these blood clots are 10 times greater if you develop coronavirus. So the risk of actually having a clot from coronavirus is 10 times greater than having a clot from AstraZeneca vaccine. So clearly then, the benefits of having the AstraZeneca vaccine are greater than the risks. And that is particularly true for older age groups, which is why the AstraZeneca vaccine won't be offered to those people who may become eligible for vaccines under the age of 30, and they'll be offered a different vaccination. And so actually, I think we're doing all we can to mitigate that risk. And I haven't actually seen any cases of clotting post-vaccination, which is really reassuring. And the data backs that up. So again, to be clear, having the AstraZeneca vaccine has saved far more people than those people who have developed blood clots as a result of AstraZeneca vaccine. We've had, I don't even know what the latest tally is with respect to the number of people who have died from COVID in the UK. It's going to be, significant. Whereas there have been, I think, 17 people, and don't quote me, those numbers have changed, who might have developed complications from the AstraZeneca vaccine who have then gone on to die. It's significantly less.
Okay, thank you. And if anybody's got a question, they can WhatsApp us. Our WhatsApp number is 0774 8855 055. You're listening to Radio Ramadan on 87.9 FM. Yasmin, just a question. I know that your team, you work for the NHS. You're one of the senior managers in Leicestershire's NHS Primary Care Trust, effectively, and you've been doing lots of work trying to encourage people and trying to get more people vaccinated. What's happening over the next few weeks? Because I know you've gone an extra mile again.
Yes, so in the next few weeks, one of the things we're planning actually with Tariq's team and Aegis PCN particularly is around running some clinics for Ramadan. So looking at dropping clinics over a couple of sort of late afternoon evenings on the weekend to enable people to have much easier access to the vaccine. Because obviously people are concerned, especially from the community where they are feeling that they can't have the vaccine. Again, I wanted to reiterate today that it is absolutely permissible to have the vaccine whilst you are fasting. It has no nutritional value, so therefore it's completely permissible. However, saying that, we're still running these clinics so that it enables people to have that flexibility. We know that people's timetables change when they're fasting. So, where they would be up earlier in the day, they'll be doing things more later in the evening. So what we're doing is running these clinics so that it makes it much more convenient and flexible and accessible, and particularly focusing these clinics in areas where uptakes to date has been relatively low or challenging, so that we can improve the uptakes in those areas.
Excellent. Thank you very much. And, it's great to see such a diverse amount of people working in the NHS, and people like yourself who are real role models to lots and lots of women out there, I'm sure, because you're in a managerial role of a really large organisation and doing a fantastic job, may I say as well. So thank you very much for coming on, Yasmin. I know that you've got to go and prepare your iftari, and we'll be joining everybody back in a few minutes after our break.
Thank you.
So if you can go, and then I'll get. Right, get on.
live.
It may be worth getting into though, Tariq, and I do wonder about, because I think
We're live in a second.
Okay, we're going to go live, please. Everyone quiet.
Assalamu alaikum,
What-
brothers
what-
and sisters. Assalamu alaikum, brothers and sisters. My name is Zafar Haq. You're listening to the NHS show on Radio Ramadan 87.9 FM. If you've got any questions, we're talking about COVID-19 this evening. The telephone, the WhatsApp message number is 077 488 55055. If you've got any questions on COVID-19, we've got the experts in the studio with us, and we'll be able to hopefully, inshallah, answer all your questions. So I'm just going to go to our new guest, Dr. Muhammad Tafel. Dr. Tafel, just tell us roughly, first of all, assalamu alaikum to you. What do you do at the hospitals, and how have you been involved in this COVID-19 hospital endeavour on the NHS?
Thank you, Zafar, for the invitation. So I am a consultant respiratory physician at Glenfield Hospital, University Hospitals of Leicester NHS Trust. So as a respiratory physician, I have been very much involved in management of COVID-19.
Can I just ask you, first of all, COVID-19 is a respiratory illness. Is that correct?
It is mainly a respiratory illness because it is caused by a virus, coronavirus, and virus can involve almost any part of the body. But yes, I agree that it mainly involves the lungs, but it can involve other parts as well.
Okay, and what have you been doing? You've been busy for the last almost 18 months now. What have you been doing at the hospitals, and how have you been helping patients?
It has been challenging. Basically, it is a new virus and it is a new disease. And for that, when we started with it, was very challenging when you don't have any approved medicines or treatments available for this. And there are patients deteriorating in front of you and you can support them. And we are not used to that. We as doctors want to do something for our patients. But with the passage of time, with the help of science, and we should be proud at the same time that in the UK, we set up many trials to get more and more approved medicines. As you know, dexamethasone, the steroid medicine, which we use for patients with the COVID-19 pneumonia or infection, it was approved from Oxford, from the UK. And also the vaccines we have developed, I think they have played a role. So I see light at the end of the tunnel, though we have been through very difficult and challenging times.
And you've been working in the hospitals almost non-stop for the last 14, 15 months. You must have saw lots of patients from the Asian community, BME community, and people who you know. How's that been difficult for you personally?
I think that has been very emotionally challenging for us when you see the patients and you don't have that human touch, basically. You know, there was a restrictions for the relatives, the loved ones to go and meet their patients there. And yes, you can do a Zoom call or FaceTime call, but I think absence of that human touch for patients who are especially dying or they are at the end of life, I think that was very challenging for us. As far as the BAME community is concerned, obviously we have seen, especially in Leicester, many patients coming from same families especially. And I have seen in front of my eyes both parents or many members of the family dying and not surviving. But with the help of our campaigns and with the help of a community, with the proper social distancing and all the measures which we have taken, I think I see that we are coming out of it very soon.
That's really good to hear. Inshallah, hopefully we'll be out of this very quickly. Dr. Tafel, lots of people have been talking over the last few months that, COVID, lots of younger people, COVID is not real and it's not affecting the community as badly as what they think. You've been in the hospitals. You've been there in the front line. You've seen those patients. How do you think it's affecting our community in particular?
That is very important to realize that this virus does exist. Hence, there are about 127,000 deaths in the UK from this new virus. And this is a virus which is very contagious and deadly. We have not seen something like this in our whole careers. And this is a pandemic. There is no doubt about that this is a new disease. There was emergence of a new virus. And for someone like me who has been on the front line and seeing patients deteriorating in front of your eyes, there is no doubt this virus exists. The only way we can control it to understand that the existence of this virus, and also to take measures, especially in the young population, that they take all the social distancing, washing hands, wearing masks, all those measures, so that we can reduce the spread of this virus. No, this virus is highly contagious. I have seen contagiousness not only within the community but also in the hospitals. You can see that there have been outbreaks between even doctors when they are talking to each other, etc. So definitely this is a new virus and it's serious and it should be taken seriously, and it is so contagious that it can spread very fast.
Thank you, Dr. Tufel. You know, there's another sort of question that always comes to mind. Lots of people are saying this is really older people's problem. It's mostly people who are over the 50s. Is that really the case? Have people in their 20s and 30s been in hospital, in the beds at the Glenfield Hospital?
It's not the disease of older people. It is a disease of everyone, actually. Though age is one of the factors. It is an adverse factor for when we try to calculate the prognosis. Age is only one of the things, and you could see that maybe someone who is 85-year-old is fitter than someone who is 60-year-old. So it is just taking into account that way, but otherwise it can affect almost all ages. Obviously, the patients who are older, they don't do very well if they get this infection, but otherwise anyone can catch it. And young population should be very much aware of this.
Yeah, I know somebody recently who I spoke to was in hospital who's 30, 31, and I know somebody else who's in their 20s who end up with a hospital stay for a couple of days. Is that quite common, or has that happened quite recently?
That has happened more in the second wave, and as you mentioned, age, but there are other factors like being obese is one of the big risk factors, whether you are young or old, and if you have any underlying conditions like asthma, heart problems, lung problems, kidney problems, that puts you at high risk as well.
I certainly know from my own experience that lots of friends that I know have died from COVID-19, and I was just horrified when I went to the Qabristan recently just to see how many graves has been been dug over the last 1 year, 12 months. It must be really heartbreaking sometimes when you see those sad scenes in the hospitals.
It is, and for us, the doctors, it has not only been physically challenging, but it has been psychologically challenging, and I should admit I have cried a few times as well. And when you see the loved ones dying, and especially from the BAME community, in our community, we want to be on the side of the patient who is dying, but that was not allowed, and that has been very difficult. And we have done our well. I have held hands of many patients, and this was opportunity for us to help the humanity, and I think we have gone through it very well.
Mashallah, you guys have done a fantastic job, and my appreciation, and I'm sure all the listeners' appreciation to the NHS staff who are working at the hospitals for such intense pressure for so long and doing such a fantastic job. Really pass my appreciation on, because I know it's not only physical, it's a mental strain on everybody who's been working there. One of the questions, what would you be advising people to do? To have their vaccine, what would you be saying to people? What should they be doing?
I think we should be very much pleased that we have been able to get these vaccines out in a very short period of time. And that is a blessing, I will say. And vaccine is the only way out of this pandemic. And I should be very clear that if any further waves comes or any variants arise, our worry is about those who are not vaccinated. Those will be the people who will unfortunately end up in the hospital. Vaccine does provide protection. Vaccine does prevent you having a serious illness or even death. So my humble advice to all the community will be to please get vaccinated. And that is the concept of Ramadan, that you help yourself and you help others. If you don't get virus, you don't spread to others as well. And so please do get vaccinated, and that is the only way we can come out of this pandemic and come to some sort of normality.
Thank you very much, Dr. Tufel. I know, I'm going to go to Dr. Tariq Kapasi, and then I'll go to Helen. If your final remarks, Tariq, if there's anything that you want, a message out there to the community to say, how you feel about this COVID-19.
Yeah, thanks, Zafar Bhai. So get your vaccines. You know, we have seen our patients die in Leicester City. It is the most effective public health weapon towards coronavirus. And you will protect yourself and your family members. We wish you a safe Ramzan. Make sure you practice all the sort of public health advice through Ramzan. I know we're really keen on having those joint iftaris, not this year, but inshallah very soon, so that we can live, inshallah, to another Ramzan. Assalamu alaikum.
Helen, what would you be saying?
So my message absolutely is consistent with everybody else. Come down to the People Centre, go to your GP where they're vaccinating. You'll be made to feel very welcome, and make sure you get your second dose of vaccine. That is critical for people. So make sure that you go back. It's not just one, it's two. So go back for your second one. And then we'll make everybody as safe as possible, which is what we want.
Thank you very much, Helen, and thank you very much, Dr. Tariq Kapasi. Really appreciate your time in joining us, and please make sure you go back to your staff and everybody working at the People Centre and across the vaccination centres and in the GP surgeries to convey our thanks to them for all their hard work and dedicated time they're putting into making sure that we all stay healthy and safe. Dr. Tafel, what would you like to sort of give the message? You've been in the hospitals, you've seen lots and lots of patients, lots of people are saying, look, the hospitals are empty. That hasn't been the case, has it?
Absolutely, that has not been the case. And at the peak of the pandemic, we have been having hundreds of patients admitted, and especially we have to set up special wards for these patients. We don't want to be in that situation. It is not only getting the COVID-19 infection, but as you may have seen in the media, these are the after effects of COVID as well. So we have proven recently that 7 out of 10 patients, they are still symptomatic 5 months down the line if they get COVID-19 infection. So having vaccine and avoiding getting the virus by taking all the precautions and social distancing, and also not to having the false reassurance that I am vaccinated and I'm okay. I think that is important, that we follow the government guidelines, follow all these social distancing measures, and wear masks and get vaccinated. That will be my advice.
Thank you very much, Dr. Tafel. And I wanted to thank you to you and all the guests that have come on today. COVID-19 is not going away. It's going to be here with us for 2021. And, lots of people have got, ideas about different theories and everything else. But the safest thing is to get your COVID vaccination. Go along once you've got your allotted time. At the moment, currently, everybody over the age of 45 is being asked to come along and get their COVID vaccinations. The NHS is making every single attempt from various different angles to try and get those patients in. We've got the People Centre running. We've got lots of GPs who are going out of their way to organise clinics early on in the evenings and different times at weekends to make sure they get their patients vaccinated. And it's really, really important that we all play our part to get these vaccinations because it will save lives. And we can just hear the pain of lots and lots of people. I know certainly lots of my friends that I've lost, and I still remember them every time, at prayer time, because, it's, how do you justify something that happens all of a sudden to somebody who was reasonably fit and healthy? And it is really, really sad at the numbers of people that we've lost over the last 12 months. We'll be talking about COVID over the next 3 weeks. We'll have a special 15-minute segment in every program that we're doing over the next 3 weeks. So please try and join us. The program is about the NHS, about how doctors and the NHS is helping patients and what we can do to help. So please join us every Thursday from 6 o'clock to 7 o'clock. This is Radio Ramadan on 87.9 FM. Please join us again next week, and inshallah, enjoy Ramadan, and happy Ramadan to everybody, and let's make sure that we do everything we can to make this a blessed month.
Thank you.